Hi everyone, I'm Dr. Vinod. I'm working as a physician at Baptist, and with us we have Dr. Indu, senior consultant in medicine and infectious disease. One man came, 45 years old. He told his BP is very high and he's having headache, and you know the reason, family problem and stress. Check the BP is normal. So the reason we thought we should speak to you is May 17th is the World Hypertension Day, and the theme for this year is measure your blood pressure accurately, control it, and live longer. Now, is BP a problem? Should we check it first? What do you think, Dr. Indu?
The thing is, most often blood pressure comes from, it could be essential where you have no family history of hypertension or anything, but we are seeing more and more youngsters coming to us with higher blood pressures. Now this most often I think arises from stress, say either in the work environment or at home. People are sitting at home and working from home for the past 1.5 years now, so I'm sure that adds to the stress. Often what is perceived as elevated blood pressure is not correctly elevated blood pressure. So for you to say that you have an elevated blood pressure, you should have measured it accurately. Now when we talk about accurately, I think each and every home nowadays has an electronic blood pressure machine. Now you have to understand one thing, that most of these electronic blood pressure machines will give you different readings. If you take 5 different readings, it's going to give you 5 different times, different readings at each time. So it's not very accurate. So if at any point of time, although it will tell you whether it's high or low, so it's very important that you go to a physician and get your blood pressure adequately measured, correctly and accurately. And then too, just with a simple single value, we're not going to treat hypertension. Very often we wait for 3 readings at 3 different times, and if all 3 readings tend to be high, only then the patient is labeled as a hypertensive. Okay, so accurately is that.
On an average, we say the blood pressure should be less than 140/90, but as ma'am told, with just one reading, say the BP is 144/94, we don't start on medications right away. We'll have to confirm and see if the BP is actually high or is it just stress related. So definitely we will tell them to check the BP again, another 2 more occasions, and then come back and check the BP, and then if it's still high, then we may advise on medications. And everyone should have a good lifestyle. Lifestyle changes are needed, like low salt diet, reduction in stress and exercise. I think this is very important to also, it's a healthy lifestyle to control the blood pressure. In an elderly, even if they are more than 75 years, we would say blood pressure more than 150/90 as the target, and if it's going above that, we may start on medications. But patients with other underlying comorbid conditions like diabetes, kidney disease, then we may say to control the blood pressure even very well, maybe keep it even less than 130/80. Now, ma'am, do you want to tell more about stress and BP?
Yes. See, stress is something that is manageable. It is not necessary that you let the stress get to you. So there are various ways in which you can manage stress. Each one has their own way of handling stress. So there are people who can do meditation, who get away with meditation. A lot of people, I advise meditation as a first measure to lower the blood pressure. If the patient is, say, young and the blood pressures are not very alarming, then meditation is the first and simple way. Or simple exercises, simple meditative exercises. Yoga is said to be very good for stress relief. Or even, just aerobic exercise, even walking daily for 30 minutes in a day will bring down your blood pressure. It not only brings down your blood pressure, it helps control your sugars, it helps control your cholesterol levels. It actually activates all the good hormones in your body, which makes you feel good as well. So these are simple things. And like Dr. Vinod was saying, you can have low salt diet, you can have high potassium diet, that is adding a lot of raw fruits and raw vegetables to your diet. If you do not have kidney diseases, basically, you can add a lot of fresh fruits and vegetables to your diet, which has a lot of added potassium, and that again additionally brings down your blood pressure. So one thing you have to understand is there are patients who may be young but who still need medications.
Yeah.
So when is it that we would think of adding medications to younger patients, Vinod?
When patients below like 30 years come, they are considered as a young hypertensive, and we will definitely need to follow up these patients and first diagnose if they are hypertensive or not. One good tool is called as an ambulatory blood pressure monitoring. So it's basically like a cuff which records the blood pressure throughout the day. They can go home and come, and it records the blood pressure throughout the day and night. And when they see the average blood pressure, there are different cutoffs for it, and we can definitely say if the patient is a hypertensive or not. Because as we were discussing, stress can play a lot of things in most of the medical conditions. Now, it's also called as a white coat hypertension, where you check the blood pressure in front of a doctor or a nurse or a physician, and the blood pressure can be very high. It's not necessary that the BP is very high. So we'll have to first confirm accurately and diagnose the patient as hypertensive. Now when we come to a condition called as a young hypertensive, there are other medical conditions which can also cause BP to go high in a young individual other than stress. So sometimes there are what we call as a renal artery stenosis, where the kidney blood supply can get little bit narrowed, and that can in turn cause the BP to go high. There are other rarer conditions which is there, but based on the condition we'll have to evaluate the patient.
We need to evaluate before we find out the reason for the hypertension.
Also adding to the same thing, if now first time itself the patient comes with what we call as an accelerated hypertension, or if the patient has end organ damage like heart attack or stroke, so even though the BP is little bit on the higher side, we may still need to treat it. We don't need to wait for the second or the third measurements.
And what we need to understand is controlling hypertension is very essential, because it can lead to end organ damage like he was just mentioning. So the major organs which are affected by the high blood pressure are your heart, your kidneys, your eyesight. So you can have hypertensive retinopathy, where you can even lose your eyesight if you do not take care of it adequately. You can have kidney disease, chronic kidney disease, even leading up to dialysis. And you can have hypertensive heart disease, where you can have just a thickening of the muscles of the heart because it's beating against a higher pressure, or you can even have a heart failure for those who have had hypertension for a long period of time, which is why it becomes essential for us to manage hypertension adequately and control it.
Do you think hypertension is a silent disease, ma'am? Because most of the patients who come, they say, I don't have any symptom, but we detect in the OPD or the outpatient department and say it needs treatment.
Correct.
But
it's difficult to convince people at times that they need to take medications for hypertension, because they may not have any symptoms as such. There may be just a mild headache or just a vague discomfort which they think will just go away. But if you are hypertensive, you do need to take treatment, you need to control it to live longer and healthier.
And do you think diet plays a role? I know you told about low salt diet and fruits. Anything else we can do, ma'am?
Yes, to avoid fatty food, oily food, and that's it, I guess.
I think most of them love chicken, mutton, fish.
Yeah, to avoid red meat is another thing. It will also bring down your cholesterol and also bring down hypertension for that matter. So chicken is said to be quite okay, provided you take it in moderation, of course.
I think all Indians love pickle. I think the food itself a high salt diet. My only caution is if the patients are already on what we call as diuretics, be little careful on the salt intake. You may need to discuss with your physician. And do you think all patients will need tablets, ma'am? Because most of them ask, like, doctor, we have BP. Once I start, will I need to take it lifetime?
No, many a times you may be able to stop it with lifestyle modification. What does lifestyle modification? Like what we've told, the stress reduction, exercise, eat healthy. With all these, if your blood pressure comes down and is well controlled, we can always stop the medications. Not everyone needs to be on a medication all the time.
Okay.
But it's necessary to then check regularly.
Do you want to talk a little bit on what is systolic hypertension, diastolic hypertension? No?
Yeah, see, when you look at or when you read blood pressure, when you take a measurement, there are two parts to it. One is called the systolic hypertension, which is the upper part of your blood pressure, and the diastolic hypertension is the lower part of your hypertension. Now, your systolic hypertension tends to go up as you age and your blood vessels become stiffer and stiffer. So, it indicates a aging blood vessel basically, and the diastolic blood pressure is more in relation to your heart, how well your heart relaxes or how well your heart is able to accommodate and push Okay, so earlier, say it was, I think prior to 2018, if I remember correctly, isolated systolic hypertension would not be treated very aggressively. However, isolated systolic hypertension has also been found to be associated with higher morbidity, which is why now we do not take that as a separate entity. We do treat isolated hypertension, systolic or diastolic hypertension as well.
I think the incidence of strokes are higher when
with
patients
isolated
have
systolic
BP which is not
hypertension.
controlled.
Yes.
So I think definitely controlling the blood pressure would be needed, because even if a patient develops stroke, it's going to definitely reduce the quality of life, and it may increase the morbidity, and they may actually develop other complications, and they can get complicated quite a lot. And you think other illness with diabetes have to be handled, like diabetes, hypertension, cholesterol?
See, as most of us know, if you have diabetes for a period of say 5 years or more, which is not very well controlled, you end up having hypertension as well. So, and if you have diabetes and hypertension, you develop a kidney disease much sooner than others. And if you have diabetes, hypertension and dyslipidemia, you end up with everything possible. So it is not an entity in itself. However, it has to be a wholesome treatment, or it has to be a holistic treatment for all the three diseases.
So I think in this COVID era, I think all of us should take precautions and be vaccinated. Make sure you use check when it's needed, and take your vaccines when it's available. And towards the hypertension, I think we'll have to measure it accurately, control it, and live longer. Thank you.
Absolutely.